Hi everyone. It's really good to see such a mixed audience. I was having a chat to people in the break, and there's not only people that obviously work in mental health or well-being in some shape or form, but people with a kind of more of a physical activity remit, food and nutrition. So it's really good to see that diversity. My name's Lorna. I'm a consultant in public health. I work alongside Emily in the Health Improvement Division within Public Health Wales. And I've been asked today to talk to you about the whole school approach to emotional and mental well-being 3 years on. So this is a programme that I know actually many people in the audience are probably much more familiar than actually I am, and actually working on the ground in terms of the whole school approach. So I really encourage you to speak to your colleagues in the audience, and also this afternoon to complement this presentation. There is a session being led by Greenhill Primary School in Cardiff that will really bring some of what I've got to say into life, really, and bring it to life. So, the whole school approach to emotional and mental well-being, I was so happy to hear the Minister this morning reference the whole school approach specifically. That was great to hear. We are 3 years in to the whole school approach to emotional and mental well-being, and we're really pleased that there is a financial commitment from the Welsh Government to continue for at least another year, and we recently heard that, so we're really pleased that it will continue. The first 3 years, of course, all of this work is really long-term. It takes time to embed some of these practices and ways of working, particularly within a school setting that's so complex and has so many different demands on it. So really we've just we've almost scratched the surface in the first 3 years, and so this next year will really build on what's already been done. So I'm going to talk I'm really mindful that we kind of use a whole school approach to emotional and mental well-being, which A is a mouthful, and B, not everyone knows what that is. So I am going to do a bit of explaining, so apologies if you're well versed in what it is. A little bit about the way of the cycle of improvement that we're asking schools to think about in terms of their way of working. Some of the ways in which we're trying to measure impact, because of course that's what we're all in this game for, isn't it, is to improve children and young people's mental and emotional outcomes, aligning with what Emily provided this morning in terms of the data, including our own monitoring and an evaluation data from the programme itself. So Public Health Wales takes a coordinating role, and it's actually obviously the schools who are doing the work, and they are supported by a network of implementation coordinators. I know we've got at least one in the room, and there may be others that I haven't spotted yet. So really I'm speaking on behalf of the implementation coordinators primarily, but obviously also the schools. So a little bit about the why question, and as Liz said, probably preaching to the converted in a way, I'm sure you all know this. And we've heard from Emily about the picture of children and young people's worsening mental health outcomes and concerns surrounding that. Liz earlier as well alluded to the pressures in terms of the demand on specialist services. And thinking about the school as one setting, as part of their wider community, as part of their nest, that the majority of young people and children do spend a lot of their time in, acknowledging that that's not applicable to all children and young people, of course, but actually for the majority of children, they will spend a proportion of their time in school. So it obviously makes sense to ensure that school promotes that positive sense of emotional and mental well-being. And there's a really strong evidence base for promoting health and well-being as part of a whole school approach per se. So there's lots of data and evidence that comes from the World Health Organization, UNESCO, that supports a way of working in schools that's not just about what children learn, but about the whole environment, the culture, so on and so forth. Just a quote at the bottom there, and I'm really sorry for the text-heavy slides, I will send them out, but that school-based interventions are most likely to bring about change when applied across the whole school system. So This is just a quote, I won't read it, but I think it's just a nice one to demonstrate that link between health and education. We know that education has a huge influence on our health, but also that health and well-being have also a big influence on educational outcomes. So the two things are inextricably linked, which is why obviously the work that we've been doing around the whole school approach makes complete sense, and which is why there is obviously such a strong evidence base for it. So just a little bit of background around what I mean really by a whole school approach. So just a couple of slides. So the whole school approach to emotional and mental well-being, primarily based on a more broader whole school approach to health and well-being per se. So a school that's constantly strengthening its capacity as a healthy setting for living, learning and working. So it's obviously not just about the learners, it's about the parents, carers, the governors, the staff themselves, as well as the wider community. And I think it really does chime with what we heard as well from Helen earlier in terms of the NEST principles, as you were talking through there. Obviously this is a way in which schools can completely align with the NEST principles that we heard about before. So just to give a bit of an easier way of thinking about what a whole school approach is. So it's thinking about the fabric of the school, the way that the school is run, it's the life of the school and the fabric. So thinking about, for example, the leadership and the values and ethos of the leadership team and how health and well-being, including mental well-being, is set as a high priority. It's about understanding the needs of the learners and the staff and the wider community so that anything that's offered within a school setting responds directly to some of those needs. We've heard a lot about how involvement in decision-making, engagement and communication is really important as well for everyone's mental well-being. Obviously in schools there is a workforce, so again that's a key pillar of a whole school approach, ensuring that obviously that the workforce is able to look after their own mental well-being, but also they have that understanding more broadly about learners' well-being. Obviously the curriculum, particularly in line with the new curriculum in Wales that has a real good focus now on health and well-being. Obviously the physical environment of the school, the culture, the ethos, the way we do things around here, and also help and support services. So the school having that understanding about where they can go in relation to individual learning needs, for example, as part of the wider community. So the framework was obviously mentioned this morning. Emily mentioned it as well, that was published in 2021. So this was Welsh Government's policy statement, if you like. It was published as statutory guidance for all maintained schools at that time, for schools to think about how they would prioritise the emotional and mental well-being needs of all children and young people, as well as school staff, as part of the whole school community. So it really gives schools the opportunity to promote positive mental well-being, prevent ill health, and to take action and to support individuals where needed. It recognises that every aspect of school life can impact on our health and well-being, not just what takes place in the classroom, as I've said, but in all the day-to-day activities of the school. The relationships between people are really important, and the environment in which the learning and the activities take place. So it considers all aspects of need, so thinking around universal approaches that will be applicable to all of that school community, as well as perhaps targeted approaches where we know there are children and young people at perhaps higher risk of certain emotional and mental well-being difficulties, and also indicated interventions where children and young people are displaying particular symptoms perhaps, and really involves everybody working together to improve well-being based on that really good understanding of need. And those three pillars really, they underpin, if you like, the framework. So that sense of belonging, efficacy and voice. So all of the framework and what the implementation coordinators are currently doing, working with their schools, is really building on those 3 pillars, particularly in relation to relationships as well, social relationships, and how children and young people feel as part of that wider community. And then that links in as well to some of the Shern data that Emily alluded to at the end of her presentation, around some of those feelings of feeling connected and feeling that teachers care, and so on and so forth. So it encourages schools to think about what they have in place, and then schools are supported. Obviously, we're not leaving schools alone. It's a complex thing to do. We have a workforce there to support them, and obviously PHW is helping to provide that kind of network of support as well. I'm actually going to skip over this slide and come to this one. Again, don't expect you to particularly be able to read the detail, but just to get the gist. So schools are really used to now self-evaluating and taking on board this kind of continuous improvement approach. So they will never completely achieve the framework for emotional mental well-being, for example. It's a continual process. Obviously, new learners come into a school every year. They'll have different needs, they'll have different priorities. And so schools are asked to kind of work through this continual improvement cycle, so that they will start with scoping out what they need. They'll draw on different sources of data. They'll know from their own conversations with parents, their own observations of children, what those challenges might be, and perhaps what they're doing well. They'll then be able to develop an action plan based on their needs as a school, but obviously thinking about their strengths as well. And they will engage in this continual cycle of evaluation, reflection, and kind of starting again, if you like, and going through this circular process. So that's essentially what the framework is asking schools to do. And as I said, this afternoon, you'll be given a very real life example of how that's working in practice. Obviously, one of the questions I often get asked is, well, what difference is this making? How do we know? How do we know it's working? Should we continue to fund it? And of course, that's, with this particular topic area, is a really difficult question to answer, especially when you've got so many different influences on children and young people's mental and emotional well-being. But of course, we have to try and answer some of those questions. So we have some monitoring data from the programme itself that PHW works with the implementation coordinators to pull together, that I'll share in a moment. Public Health Wales has also done a series of process evaluations of the implementation of the framework so far. And I've just described what the different phases of that are. So they've looked at, how schools are able to self-evaluate. PHW has provided a tool for schools to self-evaluate themselves against, where they can kind of rate themselves against different indicators that align with those core components of the whole school approach that I explained earlier. And there's also an independent evaluation, so a much larger study being undertaken by Decipher, funded by the Wolfson Centre for Young People's Mental Health. Obviously, they haven't got to the end of their evaluation period, but they have published a couple of publications already that I've presented as links at the bottom there. And obviously, they will also be using Shern data to think about what some of the longer-term impacts and outcomes are for children and young people and schools more generally. So just to give you a flavour, so this is from one of the, this is a graphic taken from one of the process evaluations that Public Health Wales, in fact, Emily's team undertook, found that a school culture that prioritises well-being was found to be very important in helping schools to successfully plan and implement well-being actions. So you can see that the way in which schools have developed a culture that prioritises well-being is shown here. So things like creating that sense of mutual respect, having a connected school community, a supportive senior leadership team, promoting pupil compassion, building relationships amongst everyone, all contributed here towards building a school culture that prioritises well-being. And all of these graphics, there's a series of them. They're available on the Public Health Wales website if you're interested. And when I send the links out, I will put the links on the slide as well, so you can access those a little bit more easily. And then the second graphic, so this one has come from some of the Wolfson work. So as part of their evaluation of the whole school approach to emotional mental wellbeing, the researchers have asked teachers about wellbeing in schools. So they've interviewed primary and secondary staff, asked them how wellbeing needs have changed in particular since COVID. And while most pupils were functioning well, there were some clear challenges. And they've developed some posters that highlight some of those challenges. So, for example, if you can't read this at the back, they've seen an increase in developmental changes and issues. So, for example, things like speech and language difficulties, challenges with toothbrushing and toileting, that obviously all relate to this whole school approach around emotional mental wellbeing. They've identified social changes, so learners finding it more difficult to work and communicate in groups, for example, which perhaps makes sense in the way in which things changed whilst children were off school. And obviously in terms of mental and emotional well-being as well, so learners describing themselves as experiencing anxiety, for example, and challenges in emotional regulation. And this is obviously helpful for us because it can help us to tailor some of that support and guidance then for schools. Obviously, if we're aware of what teachers are experiencing, we can kind of help from a public health point of view and a healthy schools point of view to support teachers in some of those challenges that they're facing. So those are kind of more from the evaluations. The next slide is just giving you an idea of engagement, school engagement with the whole school approach to emotional mental wellbeing framework currently. So I don't know if I've got a pointer on here, but have I? Yes. So this one is all schools. So the blue is schools who are on board. So they've started to engage with the programme. The orange is schools who have started that process of self-evaluation. So they've started to think in relation to the domains of a whole school approach. What are they doing well? What do they need to work on? And that's kind of giving them the information that they need to formulate their action plans. And then the green here is the schools that are actually action planning. So they may be implementing part of that action plan, but they've actually got to the stage where they've thought about what they need to do and they're starting to take action. So I think if you didn't know anything about this graph and you saw those bars, you'd think this is going really well, particularly in the secondary settings. The schools have engaged extremely well with the framework, so they've been working on it for the longest, for the past 3 years. And almost 100% of schools, secondary schools in Wales, currently action planning, which is a fantastic piece of data to be able to communicate out there. Obviously, there are some schools that aren't engaging, and we're working with them and with the implementation coordinators to think about how we can break down some of the barriers that maybe they're facing. But, primary schools who have really been onto this, probably not long, maybe last 12 to 18 months, also doing well. And obviously, there's a far higher number of primary schools. And then overall, around 3/4 of schools action planning. So yes, it's some really encouraging work in terms of establishing, and now the next phase will really be thinking about, okay, so what are schools doing and how are they doing it and what else can we do to support them in their role. All the slides are available in Welsh. And next steps. So I've said we're moving on to a kind of next phase, if you like. We've had 3 years of establishing and starting to embed, and now really working with schools, particularly the primary sector, to embed that whole school approach even further through that kind of continual improvement approach that I described. Over the longer term, what we want to do is provide schools with. What we've been told by schools is that there's too many things, there's too many programs, there's too many initiatives. So in terms of health and well-being, what we're trying to do is bring this all under the banner of the Healthy Schools programme. So actually earlier this month, we published some new proposed standards for the Health and Wellbeing Promoting Schools scheme that absolutely incorporate all of the work that's been done so far on the whole school approach. So we've got a new proposed set of standards for health and wellbeing schools. And if you know schools and how they work, previously they would have been looking to achieve a National Quality Award for the healthy schools, which was much more prescriptive for them and very topic based. So they had to do work on mental well-being, but also tobacco and substances, physical activity, and it could feel quite overwhelming. So this new set of standards give back to schools much more of that flexibility about what they can choose to focus on. But the achievement of the standards is very much based upon the whole school approach to emotional mental well-being. So they really are one of the same, but the standards hopefully give a bit more of a straightforward way for schools to think about things. So that's kind of where we're moving towards in the future. All of the standards are online, and we are encouraging people to respond to them. So when I do send the slides out, I'll add that link if you are interested. And that's me. I thought I had a film, but maybe I took it off. I was going to show you an animation as well, but actually I've probably run out of time. So yeah, when we get to the panel bit in a sec, I'm happy to take any questions. Thank you.